Allah, we start our session today about determining when a fracture has healed. How to determine when a fracture has healed? We have three main criteria. First, the clinical assessment, the radiographic evaluation, X-ray mainly, and the history. For the clinical assessment, we have pain, tenderness, and motion. If there is absence of pain or there is no pain and tenderness and there is a motion, that indicates that the fracture has healed. No pain, no tenderness, but motion. We will look also for the X-ray and radiographic evaluation. If there is callus formation, that's a little shadow on the fracture site, and the absence of fracture line. If there is no fracture line or blurred fracture line, and there is callus formation, that indicates also the fracture has healed. We will see examples in the next slides. And the last thing, the history. If the patient had fractures before, how long it took, and we should have also general knowledge for the average duration for every limb. In general, it's like sandwich. For the upper limb, like radius, most of upper limb takes from 6 to 8 weeks. That's 8 weeks. And the foot, bones of foot, tarsal bones, also take from 6 to 8 weeks. It's like sandwich. And the lower limb, leg, bones of leg, like tibia, may take more than 3 months. So it's like sandwich, upper limb, lower limb, and foot. We will take for everyone in details. First, list, as we said, here is the clinical judgment and the radiographic evaluation and historical knowledge of how long each fracture takes. We will take the clinical firstly. We will look for patient symptoms and physical findings. First, we will look for the pain in nature, pain with motion, pain with bearing, all of this pain. If there is no pain, that indicates the fracture has healed. So we will take 3 cases. For first case, there is absence of pain and tenderness and motion, so that indicates a healthy fracture. That's a perfect case. The second case, there is absence of motion, no motion, and there is tenderness, and that indicates the fracture is still in healing, not complete healing, but the fracture is under healing. Number 3, there is a motion with or without tenderness, indicates a fracture that hasn't healed. So if I found a pain with motion and tenderness or without tenderness, that indicates a fracture hasn't healed yet. There is also a clinical note here. He tells me the patient may have local pain secondary to stiffness and disuse, muscle atrophy, and any cause of pain secondary to the fracture, not the main cause of the fracture. That's not the pain we talk about here. Second, radiographic evaluation. For radiographic evaluation, we will focus on callus formation and the bleeding or disappearance of the fracture line, mainly in the X-ray films. We will take examples here. Here is the face of the humerus. Here is the callus formation. It's a little circle of shadow. and the fracture line started to blurring. That's a healing process. Here is the metatarsal bones, second metatarsal bone. I see here the callus formation and the disappearance of the fracture line. That indicates a healing fracture. Here is also the callus formation and the blurring nearly from the fracture line. That's metacarpal bone here, the last metacarpal bone. Here is also here the callus formation and the fracture line is starting to disappear. Here too the callus formation and the fracture line blurring. That's for radiographic. The last thing for the historical knowledge, and we should know the general timeline for healing and nearly for most limbs, like we took previous. It's like sandwich for most of our limbs, like radius takes nearly from 6 to 8 weeks, and for foot bones takes also from 6 to 8 weeks. For leg bones take more than 3 months. Here also distal radius here fracture is expected to heal within 6 to 8 weeks. As we said, mid-diaphyseal tibial fracture may require more than 3 months also. For also maybe carpal bones may take from 4 to nearly 12 weeks. Nearly we can say from 1 month to 3 months for carpal bones. The last clinical notes we may take for everyone may get a different duration from other. It depends on the type of the fracture or the injury or the age or the gender. Many causes may cause that. Here open injuries guide the clinician to expect an accidental period of the fracture healing. Age also plays a role in the fracture union. Fractures in older patients heal more slowly than those in the younger patients. Here also the last note, a lack of pain or tenderness combined with radiologic resistance of the fracture line is suggestive for the fibrous union. That's a malunion, not complete healing, and in these cases will need more treatment. That's for all. I hope that was useful for you. See you in the next episodes, and thank you.